Hello, Doreen once again from Wellness Together. I am wellness coach with specialty in hormonal imbalances, sexual wellness, feminine health, right? Um, I have a passion for helping women balance their hormones because as women, we go through natural changes to our hormonal levels. We go through puberty, we go through reproduction, that's pregnancy, and then we go through menopause, right? And throughout all those levels, our hormones change, give us different symptoms, risk factors, and sometimes we don't get to thrive as we would want to be able to thrive. So I help women to be able to do that. I run a hormone reset program that runs for 3 months where I get to take you through the different types of hormonal imbalances. I get to explain to you why your hormones get to go out of whack, what in your lifestyle you're doing to get them out of balance and all that, and what you can do. For some women, it will take 3 months for them to rebalance their hormones. For others, it may take 20 days. For others, it may take 14 days. Really depends on how much inflammation, toxicity, probably maybe the different risk factors that different women are exposed to. You see, as a woman, I've gone through my fair share of hormonal imbalances, from especially when I started giving birth. Throughout my puberty, everything was fine. I had enough support. I think I was taken care of very well. I was taught how to take care of my womb and womanhood, and I think I didn't get as many problems during puberty as I did when I started giving birth. When I gave birth to my first child, I went through terrible changes to my sex life. I got very low libido. I had low sense of desire, and so many things changed as they do for so many first-time mothers. And there was no one to explain that to me or explain or help me understand what I needed to do to get my fix back. I had to unfix myself, and that's why I call myself a self-healer, because there's so many things I've gotten myself out of without so much help, right? Then with the second child, lost through preeclampsia, so many hormonal imbalances that came after that. Started losing my hair, my blood pressure stayed high, started putting on weight, the moods themselves, and honestly it wasn't a good life. And on the outside you need to work and make it look like it's fine, right? I started healing myself again. Blocked tubes came through, like imbalances to my gut. There's just so many things, and just especially from the loss of my baby, I got to realize we as women don't get as much help from society, from the doctors, about our lifestyle and how it affects our hormones and how it affects our different stages of development or hormonal changes, right? And that's what bred my passion for helping women learn how to take care of their hormones naturally. You see, hormones are chemical messengers, the bedrock to our endocrine system, meaning the endocrine system regulates growth, endocrine system regulates reproduction, temperature, metabolism, and even your mood. So your hormones and your endocrine system bring about a state of homeostasis in your body. That sounds like balance. When I get to hear balance, I just feel like I'm happy, I'm whole, I'm okay, everything is fine, I'm healthy, my body's supporting me, I'm supporting my body and all that. And that's what pretty much we are looking for in life. Balance here and there and everything else, right? So because of that, with the hormone reset program, we have so many ways of balancing our hormones naturally, from using herbs to using seed cycling, using psychosyncing, adaptogens, essential oils, and then going through the whole wellness wheel and how we can get to balancing the 7 spheres of our health so that we can create emotional wellness and at the end of the day have homeostasis. I get to take you through all that in just 3 months. It liberates you just like it liberated me. The last 7 years have been amazing because of that. I can know how to manage my weight. I know how to manage my skin. I know how to manage my nails and my hair. You spend less money. You don't have to go for toxic chemicals. You don't have to be put on a pill. You don't have to get hormonal replacement therapies. You don't need all those things. And because of that, I've helped young girls who are getting into puberty to be able to flourish through that. I've helped women who are dealing with different hormonal issues, get their life back. I've helped women take care of their periods, rather their PMS issues and all those things. I've helped women conceive, those who have been struggling to conceive, those who have PCOS, some have diabetes, there are those who have had fibroids, they've shrunk them, some have had to unblock their tubes, through the various regimes that I get to put them through. And so I'm proud of that. I'm proud of the fact that there's a movement, there's awareness, and I need you to help me create more awareness, because when one woman heals herself, she heals all the women around her, and all those other women go to heal the other women. We need a movement, a world where a woman is happy. She can be able to do everything she's doing. On the outside, she looks as amazing as she feels on the inside. So what gets our hormones out of whack? You will ask. What are the possible causes of hormonal imbalances? One of them is nutrient imbalances and deficiencies. That sets us up for poor nutrient absorption. And that means we end up having fatigue, anxiety, brain fog, and all that. The other reason why we get hormonal imbalances is imbalanced blood sugars. At the end of the day, we end up having high cortisol levels, estrogen dominance because our blood sugars are not balanced, poor brain function, thyroid issues because of imbalanced blood sugars. The other reason why we get hormonal imbalances is too much toxicity, lack of sleep. We stress ourselves too much with either inflammation, that is toxic. Lack of sleep or poor sleep in itself is toxic. Endocrine disruptors, you don't care the cosmetics you put on your body, the chemicals that you have in your house, the chemicals that you have in your kitchen. There's so many in those places, in your bathroom, among your cosmetics, in your kitchen. There's a lot of toxicity, enough to have your hormones out of balance. Poor gut health puts us up for hormonal imbalances. We have poor metabolism because of that, mood issues because of poor gut issues, and all that. So we end up having lots of cortisol and estrogen imbalances because of imbalanced blood sugars, because of poor gut health and poor metabolism. Poor liver and thyroid conversion, possible cause of hormonal imbalances. Poor liver health, lots of hormonal imbalances. As well, being overweight and obese causes hormonal imbalances. Also there's genetic susceptibility. Those are some of the reasons. Major symptoms of hormonal imbalances you will know, especially if you start struggling with fertility or secondary infertility. I know so many women who gave birth easily in their 20s, and in their 30s they can't imagine their TTCing, like try to conceive. So there's that unexplained infertility. There's unexplained weight gain or weight loss, like you've not changed your diet but you're losing too much weight, or you're gaining way too much weight. Low libido, insomnia, you can't sleep properly. Even if you go in your bed, you toss and turn, you just can't sleep properly, you can't get good sleep, or you keep losing your sleep in the middle of the night. Like I said, also low libido, obesity, you can't regulate your weight. There's also thinning hair. You have hormonal imbalances when your hair just starts receding, and thinning. And then there are bigger symptoms of hormonal imbalances, like estrogen dominance, which leads to some people having fibroids, endometriosis, PCOS, or cyst growths. There's hyperthyroidism and hypothyroidism. There's polycystic ovarian syndrome. There's diabetes. Now those are the huge risk factors associated with hormone imbalances. So you see, it starts small. It starts with very small, simple symptoms, irregular periods, PMS itself. Some people have PMDD, like worsening conditions of PMS. If you don't get to deal with those ones, then you get to handle the risk factors that are involved with hormonal imbalances. Having explained that, how do we get ourselves back to rhythm? And is there natural ways? You see, seed cycling is a natural method of using seeds and nuts to balance your sex hormones, especially along your cycle. Every woman has a cycle, average a 28-day cycle, but it's different for all of us. So you can use seeds to to balance the different hormones that are produced during the different phases of your cycle. We have 4 phases to our cycle. We have the menstrual phase, we have the follicular phase, we have the ovulatory phase, we have the luteal phase. However, when we're doing seed cycling, we tend to concentrate on the 2 major ones, follicular phase and the luteal phase. Understanding that your follicular phase can run even from day 1 of your periods, when you've just started your periods, until ovulation. Then your luteal phase starts from ovulation to the next phase of your periods, right? I will talk to you about the 4 stages of your cycle when we start cycle syncing. But for seed cycling, we will concentrate on the follicular phase and the luteal phase and the understanding of that, right? From when you start your periods, your estrogen levels, normal estrogen levels are produced, but also that's the phase when you could have estrogen dominance, right? And so if your liver is not in good health, it may not be able to exit excess estrogen out of the body, and that can mean that you get to have not needed estrogen recycle back into your system, and that again gets to cause us cortisol issues, obesity, and so many other issues, right? In the second phase of your cycle, we tend to produce progesterone and testosterone, and normal levels are needed in that phase. So seed cycling is the understanding that as a woman, you can bring your hormones back to rhythm. You can bring your cycle back to its normal rhythms if you eat foods that suit the different levels, phases of your cycle. Meaning, if you eat foods that support healthy estrogen levels and foods that allow the body to release excess estrogen out of the it means also that you get to understand what foods can I eat to sustain proper testosterone and progesterone levels in the luteal phase, and what foods can I eat to ensure that there's not too much or too little of these major sex hormones. Phase of the cycle, which is follicular phase, the moment your periods begin, you start eating, you take 1 tablespoon of flax seeds, 1 tablespoon of pumpkin seeds. You can mix this together from day 1 of your periods until ovulation. These particular seeds have healthy omega-3s. These particular seeds have lignans, especially flax seeds. Flax seeds have lignans that bind onto excess estrogen, and they get this estrogen out of your system. That's how they help us with creating hormone balance. Well, flax seeds and chia seeds are the same. They all have healthy levels of omega-3. These seeds on their own have enough proteins that will support you when you're looking for that good protein breakfast. Have healthy fats, mostly omega-3s. Now, the kind of omega-3 that we get from seeds or plant-based omega-3 gives us ALA kind of acids, right? Meaning these are not long chain fatty acids, they are short chain fatty acids. So short chain means the body takes long to convert them to readily available long chain fatty acids. So for us to be able to make sure that that happens, these seeds have their fatty acids hidden in their shells. So we need to be able to mill them, make them into powder form, so that we can make them, at least we process them and make the body take less time converting them to the long chain fatty acids. That's why it would be much better if you mill your seeds, right? And then just add them to whatever it is that you want to use them for when they're already mixed. The way to consume them is to grind them fast, make them into a powder. Pumpkin seeds are useful in the first phase of the cycle because they help to prepare for healthy progesterone production before you get into that stage, and at least they don't get to affect the first phase of the of your cycle, right? So what you do is you count 10 tablespoons, or at least mill seeds and nuts that will take you through 1 week, right? So a week I would need 7 tablespoons of each of these seeds. So I go to mill 7 tablespoons of the flax seeds, 7 tablespoons of the pumpkin seeds, mill them together, mix them. You put them in an airtight container and keep them in the fridge. Now, if you keep these seeds out of the fridge, or if you mill a lot of them at a given time, their oils run rancid. So you need to be able to mill a little at a time, and you need to be able to keep them in the fridge so that you don't lose their oils. Okay, That's the major reason for milling these seeds and nuts. So that way it becomes easy for you to add them to your smoothie, add them to just a blender, add your fruits and other elements that you use for your smoothie, blend them and have an amazing breakfast smoothie, right? So the second phase of the cycle. The second phase of the cycle requires us to have sesame seeds and sunflower seeds. The sunflower seeds have selenium, which is healthy or good for healthy testosterone, as well as vitamin E. Sunflower seeds, sesame seeds have lignans as well. These seeds have more amazing properties that help support hormone balance. Now I have hemp seeds here. Hemp seeds are the only seeds that have the proper ratio of omega-3 and 6 that is really needed for the body. So they have a good ratio of 3:1 hemp seeds to either your first phase or your second phase or all the phases of your cycle. I recommend these mostly for women who are trying to conceive, women who are perimenopausal or menopausal, and any other woman can take hemp seeds. These are hemp hearts, yeah, meaning they don't have their shell, which is also sometimes not easy to digest for some other people. So these can be turned, you can take hemp oil, you can add just a teaspoon of hemp oil to your smoothie or to your soup or to your juice, you know, or to your latte, or you can just use the seeds, or you can even make milk using out of the seeds, right? So we do the same thing. 1 tablespoon of sesame seeds, 1 tablespoon of sunflower seeds every day is what you need. So what do? You get 7 tablespoons of sesame seeds, get 7 tablespoons of sunflower seeds, mill them together, mix them up, have some amazing powder like this. This is the first aid you use. Yeah, so you make a powder, and the same thing, you just scoop of 2 tablespoons, add to whatever it is that you want to use for the day, and you are amazing. How long does it take for one to notice differences? How long do you get to sit cycle so that you can start noticing differences? Like I said, it varies. I always give most women 3 months. It takes 3 months for hormones to properly balance, especially if you follow the protocol that I took you through. Make sure you don't not take inflammatory foods, you're not under excessive stress, you get to sleep well, you manage your weight, you take care of yourself, you take care of the other areas of your body. So it will take you about 3 months. For some people it takes even less. But once you start sit cycling, you're going to notice your skin will change. You're going to notice your period comes easy, no more cramps, no irregularities, no spotting, mid-cycle spotting. You're going to notice that your weight is well managed because of the fiber that comes with the seeds. And then seeds help maintain proper blood sugar, but mostly your blood pressure is well balanced. You don't get cholesterol issues. These seeds and nuts have healthy fats that ensure that there's no bad cholesterol in our system. So your blood pressure is well balanced when you eat these seeds every day, especially flax seeds, chia seeds, and hemp seeds. They help to support your heart. What makes flax seeds amazing during seed cycling, but also when you add flax seeds to your health or to your daily routine, flax seeds help to support proper digestion. Flax seeds have fiber that when you take them, they help to support a healthy colon, right? Flax seeds have lignans in them. They help to bind onto excess estrogen and get this estrogen out of the body. Flax seeds have healthy cholesterol, meaning they may help reduce blood pressure issues. If you eat flax seeds every day, 1 tablespoon every day for 12 weeks, and you have blood pressure, you will notice amazing differences. You may even be taken off medication. Well, flax seeds help to reduce markers of tumors in women who also have breast cancer. So flax seeds are highly recommended for every woman. They're highly recommended for men as well. They help to reduce markers of tumors in men also who have prostate cancer. So there you go. Pumpkin seeds have compounds in them that help reduce blood cholesterol. So they help in the treatment of blood pressure. Pumpkin seeds are amazing for men, not only for women. For kids as well. Well, pumpkin seeds help to reduce the risk of bladder stones, right? That means they get to help balance the calcium that is found in urine. You see, some kids get bladder stones and end up having bladder disorders, which makes them have urine disorders. Pumpkin seeds will help to correct that, especially pumpkin seed oil. So this is recommended for all boys who may have bladder issues, who may have urinary incontinencies, who may have bladder stones. Pumpkin seeds are good for men's health and boys' health. They help to treat against prostate cancer. Sesame seeds are amazing. They need to be in your diet almost every other day. You see, sesame seeds have a lignan in them called sesamin. This lignan is usually converted into another easily available lignan into our body by the bacteria found in our gut system. You see, lower than normal levels of this lignan will lead us to having or developing breast cancer or developing heart-related issues. Right? That lignan that is finally converted mimics natural estrogen, so we pretty much need to be able to eat this because the lignans in the sesame seeds will be able to bind onto any excess estrogen and get it out of the system anyway. Now, women who are postmenopausal, if they eat sesame seeds every day, they improve their sex status, but also improve their cholesterol levels because sesame seeds help to reduce on bad cholesterol from the body. Sesame seeds are amazing for people who have knee osteoarthritis. You see, they help to reduce on inflammatory chemicals from their blood, ensuring that they have healthy cholesterol. Most semi-professionals and people who get to over-exercise, if you want to improve your aerobic activity, sesame seeds will be able to help with that. But also they will ensure there's less muscle injury, which is something that we look out for, especially when we turn 40 or for women who are perimenopausal. That's how amazing sesame seeds are. So we don't just add them to our diet to only balance hormones, but look at how far they go to improve our overall health. Well, now sunflower seeds are amazing because they have selenium. This will help to boost your healthy testosterone levels. Selenium is good for thyroid synthesis, thyroid hormone synthesis and metabolism. So we need good levels of selenium to ensure we have healthy hearts, we have a proper immune system that helps with gut health. We have, we have proper metabolism. Selenium is like iodine, highly needed by the thyroid. So sunflower seeds have good amounts of selenium. Sunflower seeds have monounsaturated fats, saturated fats. They have good protein. They are good protein source, so they will help a lot in helping keep a healthy heart. However, sunflower seeds reduce both good and bad cholesterol, so it's very good to balance them out with other healthy seeds like hemp seeds and sesame seeds. Having said that, does seed cycling work for everybody? Certainly not. Some people are allergic to seeds and nuts. Some people cannot tolerate seeds and nuts. And that's why I bring it down to your blood group. Your blood group can help inform you which seeds and nuts work for you, which seeds and nuts actually inflame you. Now, when you start seed cycling, we have said you need to be able to follow your cycle. So it would be nice if you know how, when you ovulate, it will mean you start decoding your cycle. You get a period calendar, chip in the first day of your cycle, get to chip in the next or the last day before the next period begins, then see how it goes for the next 3 months. That way you are getting acquainted with your cycle. You will get to know if it's regular, irregular. Regular means honestly that you get to have a period every month. Note that this time it was 25 days, our next month it was 26 days, the other month it was 27. That's not irregular. Irregular means you did not get a cycle a particular month. So you're able to tell, do you get your cycle every month? And if you get your cycle, how long is it? Is it 25 days? A normal cycle should be between 21 days to 30 days, right? So we get to understand if your cycle is normal, if we need to fix it, and then also you get to understand when you ovulate. Personally, I ovulate on day 8. Some women ovulate on day 14, others on day 15. So you need to be able to look out for what makes you understand when you ovulate. I usually like to use the cervical mucus. So people will talk about ovulation pains and all that, but I've come to understand that also if you get ovulation pains that go beyond a day, chances are that's a different condition altogether, not ovulation pains. So ovulation pains should be able to last only a day, right? So you can use those, but the best way to tell if you ovulate, if you get your cervical mucus, that's thick, sticky, stretchy mucus, it gets to help you understand. So when you get to your ovulation, chip it into your calendar so you can know I actually ovulate on day 10 or day 8, because you need to be able to eat the first set of seeds until ovulation, not for 14 days, not for 15 days or for 13 days. So you need to be able to be body wise. The other thing that you need to be able to understand is that these seeds, in as much as they're healthy, they also have cholesterol, good fats, but too much of anything is bad. So when you start seed cycling, get yourself away from other nuts and other seeds. You cannot do seed cycling with chia seeds, flax seeds, and all those seeds. No, you have to choose. If you've chosen to use flax seeds and pumpkin seeds, that's it for that phase. If you should choose to use chia seeds and pumpkin seeds, that's it for that phase. So it would be nice to understand which foods really have high estrogen to keep them only in that phase. And that's why I help women to also understand what are the phytoestrogens and estrogens, and how do you know which foods to eat in your first phase, which foods to eat in the second phase of the cycle. That we'll deal with when I get to talk to you about cycle syncing, right? As well, we have nuts that can complement seed cycling. So if you must use any nuts, make sure it's walnuts, because they will complement the omega-3. If you use flax seeds don't have as much omega-3 as chia seeds. So if you complement flax seeds with walnuts, then you'll get as much omega-3 that you're looking for. Hemp seeds, if you use them in the first phase of the cycle, as well don't have as much omega-3 that you will need daily for your daily intake as much as chia seeds. So if you must use hemp seeds, you can complement them with walnuts, and that's it. No other nuts. And then it should be only 7 walnuts. It should be only 10 almonds, not more or any more than that, right? Okay, so I was telling you that not everybody is going to be able to benefit from seed cycling because of food allergies and inflammation. Now, I take it down to your blood group. Blood group A's and O's, they will do well with the formula that I've described. So blood type A's and O's, they can eat flax seeds, chia seeds, pumpkin seeds, simsim seeds, sunflower seeds. However, they need to keep away from cashew nuts, they need to keep away from peanuts, they need to keep away from pistachios and some other nuts. So they need to strictly stick with that one. However, blood type A, B's and B's have seed and nut allergies. Yeah, so I am very careful when I'm picking out their seeds, and I'm very careful when I'm helping them balance their hormones. So you find that for blood type B's and ABs, we will not use sunflower seeds and sesame seeds because those cause them insulin issues. Instead, we will not use pumpkin seeds. We will only remain with hemp seeds, chia seeds, flax seeds, walnuts, Brazil nuts to play with. So seed cycling for a B and an AB from day 1 of your periods until ovulation, it is 1 tablespoon of hemp seeds, 1 tablespoon of flax seeds, and that's good enough. Enough omega-3, and like I said, hemp seeds already have a good ratio that will support hormone balance, so you're very good with hemp seeds, right? In the second phase of your cycle as a B and an AB, I recommend hemp seeds and walnuts, or hemp seeds with Brazil nuts. Much better with Brazil nuts because Brazil nuts have selenium, the selenium that will support your healthy testosterone. Now, for blood type A's, ABs and Bs, I recommend that you add omega-3 fish oils to your diet and evening primrose oil to your diet, to your seed cycling regimen, because you guys tend to overuse your brain. Your sense of imagination is so high, and usually you are more prone to anxiety, to mood related issues, to depression. So you need to be able to eat foods that work well with your brain, that support brain health. And that's why hemp seeds and walnuts and Brazil nuts are usually recommended in your regimen. So for blood type ABs, please add evening primrose oil in your second phase of the cycle, again because of nitric oxide, to support healthy magnesium absorption and all that. So evening primrose oil added to the second phase of your cycle, omega-3 fish oils added to the first phase of your cycle, and you'll have proper hormone balance. Finally, we get to use our seeds, blended or ground, milled into a powder, put into the fridge, and so every day, how do I get to use the seeds? Is the next question. There's so many ways. You can use them in smoothies. You can just add them to water and make a shake. Shake and just drink if you don't feel like you have time for the other things. So you can use them in your smoothies. You can add them to soups. You can add them to baking. Anything that you may want to bake, like I use them in making muffins, making cookies, in making breads. I have some recipes down on my YouTube channel that you can go to follow to see how to use seeds and nuts based on your cycle. So if I'm in my follicular phase and I get tired of smoothies, what else can I use my pumpkin seeds for? Your seeds need to be taken raw. They should not be cooked. They should not be overcooked. They should not be exposed to high temperatures. Okay, because then they will mess up with most of the nutrients that we're looking for. So you get to use them in different ways. Now, in your follicular phase, what else can you use your pumpkin seeds and flax seeds for? Well, then you can use them in your muesli. You can add them to oats. You can add them to soups. Definitely, you can use them to thicken stews. You can use them to make jams. You can use chia seeds or flax seeds to make jam. You can use them in so many other ways. Most of the recipes I get to share them in my YouTube channel. So today I'm going to show you how to really put together a hormone balancing smoothie. Supposing you're in your follicular phase like I am, I'm going to make a chocolate smoothie. It has strawberries, it has pomegranates, and it has bananas. So I just add 2 tablespoons of the seeds, make them level, not heaped, right? Now, so do you get to stop at just adding seeds and nuts to your smoothie or to your diet? No, because there's so many other factors that affect hormone balance. Like I said, poor gut health. How do we correct that? By taking probiotics. So I'll choose a probiotic. You can use kombucha, you can use apple cider vinegar, you can use yogurt, you can use kefir to be able to add to your smoothie. So in this case, I'll add 1 tablespoon of apple cider vinegar. Then I use Sesame gel to repair thyroid or to improve thyroid health. Sesame gel helps with thyroid health, it helps with metabolism, it helps with weight loss. So I'll add 2 tablespoons of Sesame gel. You can add 2 to 3 tablespoons, but I don't recommend that. Depending on how much more iodine you get to take at the end of the day, you don't want to have high levels of that. Now, you will need an adaptogen in your hormone balancing smoothie to help manage stress, to help reduce on extra cortisol from your body, to help regulate your adrenals, to help also support thyroid health and metabolism. So the adaptogens are ashwagandha, you can use maca, you can use shatabai, you can use holy basil, you can use adaptogenic mushrooms like reishi, like radiola. There's so many adaptogens that you can use. The easily found adaptogen is ashwagandha. So I make lattes. I have put together latte powders. These you can just whisk up in milk and you make a latte, caffeine free, boosts your energy, helps to support your hormones. The lattes have adaptogens as their main base. So they have maca, they have a blend of shatabai, and then ashwagandha. This is a chocolate, adaptogenic hot chocolate latte powder. I can use it in hot milk on its own and it's fine. But in my smoothie, I don't want to put just look for so many ingredients together because it's a blend. It has ashwagandha, maca, goji berries, baobab powder. So in itself, it's enough. When I add to my smoothie, I've given it a superfood punch, right? So you just need 2 teaspoons of your latte powder, yeah, and that's it. So I'll put water here, or you can use almond milk. Since I've not put almonds, you can use almond milk, you can use oat milk, you can use rice milk as your base, so you can just use water. I'm going to use water. So just like that, I'm going to blend this up and have a smoothie. That you have a beautiful smoothie bowl. I love garnishing things and making them look pretty for my appetite. Okay, so you can use your seeds and nuts in making smoothie bowls or in making smoothies. I'm going to show you also how you can use your seeds in making soup. Instead of using cream, you can use them to cream up soups. For instance, I'm going to make a tomato soup. I roasted tomatoes, right? I have basil, fresh basil. I have softened onions and garlic. Ordinarily, I would add cream to make it creamy tomato basil soup. But I'm not going to add cream. I'm just going to add vegetable broth and then 2 tablespoons of sesame and sunflower seeds. They're whiter, so they'll give me that creamy element. But guess what? They're also adding a punch of nutrients to my soup of the day. 2 tablespoons to that, because what I'm going to make is enough for one. There's so many ways in which you can use seeds and nuts. You can scroll down into the recipes where I show you how to use seeds and nuts in making butters, seed and nut butters, in making salad dressings. So this is soup, tomato basil soup. This is smoothie. Those are some of the ways in which you can use your seeds and nuts, but there are plenty more others. You and I are going to be sharing in many of those, right? Stay well, keep your hormones balanced. Stay well, keep your hormones balanced. Join the Hormone Reset program so you can be able to benefit fully in all the protocols that I'm sharing with the rest of the ladies in how they can keep their hormones balanced, and those who have hormonal imbalances, how they can get themselves back to homeostasis. This is Wellness Together. My name is Doreen.